Welcome back to Voices in Health and Wellness. This is the show that spotlights the people driving change in clinical care, patient support, and mental wellness, I should say. I'm your host, Dr. Andrew Greenland, and today's guest is someone who truly drives at the intersection of high performance and high compassion. Dr. Sharon Winters is a board-certified psychiatrist and the founder of Winters Family Psychiatry, where she works with individuals and families to navigate complex emotional and mental health needs. Her practice stands out for its deeply personal relational approach, a rare find in today's fast-paced healthcare landscape. So Sharon, welcome to the show and thank you very much for your time this afternoon.
Well, thank you for inviting me, and I hope I can do some value to the topic.
I'm sure you can. Maybe you could start a little bit at the top. Could you share a little bit about your role and the kind of work that you're doing at Winters Family Psychiatry?
Well, okay. I was asked to discuss this topic on what I guess is high achieving clinicians. And so I guess I fit that role. And maybe it's because I have a lot of initials behind my name. But I am, like you said, a board certified psychiatrist. And that is in the area of medicine. So I am a medical doctor and my specialty is psychiatry, which is about the chemistry and wiring of the brain. That's what I tell my patients. So I'm not a psychologist. I tell them psychology is the study of the mind, whereas psychiatry is the healing of the brain. I also have a fellowship in child psychiatry, which is an additional 2 years in addition to my psychiatric residency. And I'm a clinical faculty at Florida State University School of Medicine, an adjunct professor. So I have third-year medical students that occasionally rotate in my office. I also have a JD, jurisprudence doctorate degree, but I haven't practiced law. I just did that to kind of enhance my ability to kind of get through some of the dilemmas that people have, particularly with certain types of mental illnesses, when they face legal issues. And then I also have a master's certification in Christian apologetics. So I am a Christian, Bible-believing Christian. So those are my accolades, I guess, of my professional life.
Amazing. What a collection of very valuable tools and qualifications and credentials. Just would you mind telling us a little bit about your practice and what you're doing there for people, how you're helping people?
Well, I've been a practicing psychiatrist. I don't like that word practicing, but I guess I've been a practicing psychiatrist for about 40 years. And so I've been in all areas of psychiatric medicine, ranging from inpatient to outpatient to my husband and I own some partial hospital programs. And right now, currently, over the last probably maybe 10, 15 years, I am in my own private practice. My husband also is a psychiatrist, so he and I are in this practice together. We don't have any ancillary staff. We used to have nurse practitioners and clinicians that did counseling, psychology, things like that. But right now it's just me and him. And we do medical, psychiatric healthcare, which is about, I always tell people there's two aspects of medicine as a medical doctor. You're either prescribing medications or you're cutting people in surgery. So we are medical. And so my practice is about diagnosing and treating what are called mental illnesses.
Cool. And with all the things that you do, what does a typical day look for you like? What does a typical day look like at the moment? And I appreciate that there probably is no typical day, but with all the things that you balance and juggle, just kind of talk us through how it all fits together.
Well, actually, my typical day is rather ordered. I get to my office and I have my patients scheduled and I have my office staff, I have my charts, and I generally see patients for 30-minute appointments versus the typical when I was in the community mental health system, hospital based, it was like this 15-minute med check. But I have had some of my patients for years. I do see new patients. I probably get maybe 4 or 5 new patients a month, but I generally have a half an hour for follow-ups, and then we go over their medication issues. And generally, I have to say, they're doing well as far as their illness. And so we do spend some time talking about how they can apply some, I guess, techniques of, I give them advice, and we talk about a lot of things that go on in their lives, ranging all the way from birth of a new baby to elderly parents with dementia. In that role, I guess I do participate in some aspects of counseling. So that's a typical day.
Got it. So you've been in the field a long time. What would you say has changed in the last few years, especially in terms of how clinicians are expected to show up, both in their professional and personal lives?
Well, my true view of it is that probably in the last maybe 5 to 10 years, and maybe in part related to COVID, there are a lot more, I guess what we would call paraprofessionals in medicine. So not speaking for myself, but just medical doctors in general, I think they probably are under the gun a little bit more as to production, seeing patients, supervising or relegating their medical skills to paraprofessionals. Anyway, that's here in the United States. Particularly in Florida, we see a lot more nurse practitioners and PAs. Florida is the 3rd largest populated state in the nation. So we also kind of are a retirement state. So I think there's a lot more elderly people here. So we have a population that maybe has more illness. And so I think physicians are kind of more under the gun. But in addition to that, I think, healthcare has, if I don't want to misuse the word, evolved with newer medications, newer treatments, even attempts at educating the population on preventative care, so that what we see here, interestingly enough, is a lot of the family practitioners have separated parts of their business into more what I call sort of aesthetic medicine. So I guess it's all part of wellness. I mean, people, they strive for wellness and happiness, and they want to look good and feel good. So I think that's what we see now in the hospital environment. We get more, we have a lot of maybe elective surgeries. So that, again, that's more in this area. I'm sure there's some large city populations where, you got more of the very ill and the trauma. So I can't really speak to those physicians other than to my own personal experiences. But in general, there has been some lessening of stressors for clinicians, but also some enhancement of stressors, which is kind of what that topic was about, balancing your sort of clinical time, your work, with what was termed life. So I think that's more prevalent now, even.
I hear you. And in terms of the way that clients are showing up, have you noticed any shifts in recent years in the way they show up, and maybe what COVID did to change that, or anything else that you've noticed that has been an influence on the way that clients pitch up?
I'm sorry, I didn't hear the first part of your question.
I was just asking whether you've noticed any shifts in the way that clients pitch up and present themselves to you, and if that's evolved in recent years, and to what extent COVID had anything to do with that.
I'm not sure related to COVID. People are much more educated in their health. So I find, and maybe this isn't typical, but I really enjoy my patients. They share very interesting information. They seem to have decent insight and about their illness. We have sort of a collegial working approach where they respect my knowledge and expertise, and I respect them, because who knows what's really going on in anyone's mind but the person themselves. And that can be influenced by other things like culture and traditions and underlying beliefs. So I make it a point to not, and I suppose that's easier said than done, but not be judgmental on persons when they come in with particular disorders. And I think that that's one of the things that has been maybe more beneficial with not just COVID, but the whole aspect of this digital information generation. So people do have more information. Sometimes it's not good. I have a couple on my desk that says, please do not confuse your Google search with my medical degree. But anyway.
You've got the mug, have you?
Yes.
Okay. And in terms of, I mean, as again, you've been in the field for a while, and I guess treatments and therapeutics have evolved. In the last few years or so, what are you seeing that's really moving the needle to help patients forward in terms of what you can offer them?
Well, from a medical psychiatric point of view, I think it is the improvement of medications to reduce side effects. And also the research that's gone into looking at the neurobiological basis of medications, which actually, even though people think, oh, patients aren't interested in that, they really are. And so I try and put the science behind the medication, so people just don't think, oh, that's for schizophrenia, I'm not schizophrenic, or oh, that's bipolar disorder, and relate it to maybe someone they know or a family member that has really not been well medically treated because maybe the medications weren't available. So I do a lot of talk in regards to that, and I think the newer medicines are much more tolerable. I mean, people still relate to this movie that was called One Flew Over the Cuckoo's Nest. I don't know if you ever saw that, but totally not accurate as far as treatment there. So, but it's still kind of Hollywood plays a big role in how people perceive things. So I think that, the newer medications and stuff have helped people see that, you don't have to walk around with some major side effects or adverse effects or sedations or no expression on your face, this what we call affective blunting. So that's really been a positive in psychiatry.
Thank you. We hear a lot about burnout, but I'm curious to know, how do you personally define balance? And has that evolved for you over time?
Yes. Well, I think that I kind of look at balance as, well, let me put it this way. I sort of look at life as a timeline. And that timeline changes in our perspective of it based on where we're at developmentally. So whether you're a child or a teenager, an adult, an elderly adult, it also depends on our circumstances and what I kind of call our gifts and talents. And so when I look at this timeline, this kind of, timeline, I sort of put this fulcrum on it, almost like a teeter-totter. And I think of time as sort of the point of the fulcrum. So I don't really look at, I don't separate work, meaning career, with life, meaning non-career. I have them all kind of together as my 24-hour day. And maybe that's just my personality or my way of looking at things, because I've kind of always done that. I've never really thought, oh my gosh, I got to finish doing this work and finish doing this paperwork and everything. If I have some other event to do, I guess maybe that's because I've been able to be more flexible with my time. I haven't worked for like a environment other than in residency where, you had to be somewhere and you were committed to a time and you had to be on call at night and you had to answer the pager. So in that way, I've kind of balanced my work and life by what I call prioritizing, and relationships come first. And this becomes a little jumbled in the field of medicine because you're dealing with people. So you're dealing with relationships. But I have to separate that because I know that I'm simply an individual and I only have 24 hours in the day, just like everybody else. And I think this is sometimes where maybe some physicians, when they get this burnout, they don't step back and really look at their whole 24-hour day, their week, their months, their years as part of their wholeness of life. And maybe they're gravitating more to, I don't know, because I don't want to, again, be overly opinionated, but to the dollar, like, I got to do this, and this to make money. But I just feel like in my case that balance, I'm not saying it's always easy. I mean, I got traumas in my life and major events that happen that I got to address. And, sometimes I've had to cancel a whole week of patients because of something, right? And I feel, like, oh, wow, what are they going to do? Because in psychiatry, unfortunately, if people run out of medications or have an issue, a lot of times they end up in the emergency room. And that could be the worst place for them because they don't really get treated like they're ill and need, maybe a boost in their medication or whatever. They are always afraid they're going to get locked up or something. So anyway, I think about that in the back of my mind, but I'm pretty able to balance my life.
So, I mean, you mentioned, I think, prioritization and focusing on the relationships. I was just going to try and get to the nub of why other highly successful clinicians, even the ones who are mission driven and successful, struggle with this balance. Is there any other factors other than the things that you've managed to prioritize, which kind of get in the way of other people retaining this balance?
Well, I do think it's partly related to how one sees oneself. There are, I think, physicians, highly intelligent, overachievers, high achievers. That's just part of being a doctor. I mean, you can't get into medical school and residency and all that without being competitive and a high achiever. And so I think sometimes there becomes this belief that you are the all in all. And that becomes a struggle in this whole work life. What you're defining as work life, I believe, on the topic is this separation of career versus non-career time. And so I think sometimes people think they're all the all or none. And maybe that's sometimes true because we are the expert in what we do. But we also need to realize that there is a community of others that can be helpful and beneficial. Even the patient themselves, they have a say in their life, and you have to be able to assist them with that. So to be able to say, well, what should you do about this situation? Or, gee, how come you're not taking your medicine? Or, how did you end up here when we started there? And so, again, I think the emergency room is a little different, but they're supposed to be dealing with emergent things. Not necessarily are they, but yeah, I think that is what causes burnout, because people start looking at oh, I'm getting older and, I've spent my whole life devoted to my career and I've done a lot of good and I have a lot of knowledge, but I should retire. I want to go do something fun. Instead of looking at some things within our shorter lifespan as being enjoyable or fun. So I think that's where some physicians get into this battle. I also think that, and again, I really hold firm to this, I do believe that we need to really think about the purpose and meaning of life in general, and maybe who we are working for. And it's really not to accumulate things, not even credentials behind your name. It's really, I know it sounds hokey, but I really do think it's about doing your best and serving others. And there's this little movie, I think, and it was Miss Congeniality, and it was kind of like to make the world a better place. And so I also think that I look at it from a different perspective because I'm female. And I think men look at, work and occupation and obligation sort of as what they need to do to provide. And that's somewhat changed, in the last maybe 30, 40 years, really. But I see some people coming back to that even, because everybody's working 8 to 5, 9 to 5, and then they got kids and they drop them off at the daycare. And that's all really, I think it is becoming kind of like a battle. But to me, battle sort of implies war. I think it's more of a conflict, or maybe it's more of a way that we need to sort of handle again and prioritize our life, not necessarily as a war or a conflict. So
thank you. And do you think this is industry wide in the patient facing world, or have you noticed there are any particular pockets of people that really struggle with work-life balance? And I don't know whether you've sort of treated any clinicians or providers in different specialities or niches, and you get a sense that some particular things are worse than others or more challenging than others.
Well, again, as a psychiatrist and having been a psychiatrist for 40 years, yes, I have physicians, I have attorneys, accountants, MBAs, all the way down to kids and teenagers with drug problems, to people who are worried about dementia, all kind of walks of life, even in my private practice. And so I kind of sense that physicians, the ones that maybe struggle more, do have some problems with mood, and also maybe attention and concentration issues. They're very intelligent, but they sometimes have difficulty prioritizing. And in general, I think most physicians go into medicine because they are compassionate about people's wellness. But that's something else I think has changed with this whole competition and sort of the aspect of money-driven medicine that I know my youngest son just finished at Florida State University, and he is, I have to say, very insightful young man. And he and my other kids as well, I said, Mom, people seem to want to go into the biological sciences to be a doctor because they think they're going to make a lot of money. And I'm going like, and then they sometimes don't make it, or they do, but they're not really driven for the core reason of being a doctor, which is to heal people. And so that, I see that a lot, really. The physicians that don't seem to struggle as much are the ones that have really looked at that balance and that aspect of, this is my whole life, and try and devote appropriate time to outside of career obligations. And I think the hospital systems and stuff like that are really working towards that. I mean, even residency programs now, it's not like this super grilling, you got to be up for like 72 hours and no sleep because you got to be on call. Or emergency room doctors, a lot of them work like 3 days on and then they have 4 days off, things like that. So I think maybe that that voice of balance is kind of starting to permeate and may change some of that attitude and that whole concept of burnout, so to speak.
I hear you. Is there anything in terms of simple tips that you could perhaps mention that you use for maintaining some personal sustainability that people might find helpful listening to this call?
Well, I have to say that I am a very firm believer in God. And I start my mornings with prayer and giving thanks. And I always read one proverb a day. And I always read several Psalms a day. And I have a little devotion that I listen to, a little podcast that's it's not all, holy roller, stuff like that. It's kind of practical applications. And I tell you, it just sets my day up so nicely when I know that it's not all about me and what I'm in control of. And it does give me this aspect, I think, of peace. And that's not to say I don't have freak out moments or whatever, but I try and, regroup in my conscious mind. So
some element of spirituality.
Yes.
Interesting. So what's working well for you right now in the clinic in terms of things that are going well, things that you do that get the outcomes that you're looking for and the patients are seeking? Anything in particular that you can nail down?
Well, I think being an experienced clinician, I have my paperwork down. So I have my intake form that addresses different mental disorders. I've used I devised it myself. I used inputs from other sources and stuff like that, but I've had this compilation of documents that people fill out before their appointment that allows me to sort of hone in on the issue. Because, you can get overwhelmed with people's issues of thoughts and anxieties and, circumstances and stuff. So it helps me to stay sort of grounded in what in medicine is called the chief complaint. And that's one of the things I do. The other thing, I did have the same office staff for 15 years, which was great because they knew the patients, they knew me, they knew my husband, but they left the year after COVID. One of them retired and the other one kind of retired because her husband moved and she moved with him. So I have new office staff, which has been interesting because neither one of them are clinical, but they're both office manager types, but not medical in their experiences, right? So that's been kind of a teaching thing for me. But I guess one of my other high achieving gifts is that I do have a lot of leadership and administrative skills. So a lot of physicians get overwhelmed by that, and they really rely a lot on their office staff to get everything organized for them. But I've been able to do that a lot myself. So that's kept my my documentation and my, I guess if you want to say patient interview, very similar. And because I have been doing this for so long, I really can kind of hone in on areas that are depicted in some of these documents and forms, some of the answers people have, and really be like, oh, this is definitely bipolar disorder, or this is generalized anxiety or something. So that's made it easier for me to do. So that's, I think the other thing is I don't use electronic medical records. And there's good and bad to those. I mean, I would like to access more information about patients' medications and stuff. I rely on them to tell me. But one reason I don't use electronic medical records is because they kind of force one to revert to check the box. And I don't really check the box. I put down little notes, little reminders that may be like I might put something down like the patient's dog's name and that the dog was recently ill. So when they come back, I am able to, look back and say like, oh, how's your dog? Because to me, that relates to how they handle life situations in regards to things like if they have a mood disorder, whether they've lost their job, how did they handle that? Whether they have attention and concentration disorders, ADHD kind of things. I can go back on those more bullet point notes and hone in on it from a medical point of view. So that's one of the things that I find is simpler in my practice. Plus, I get to choose my patients better now, which is really helpful too. I have an intake form, and again, I've honed it down so that I can kind of tell by how they fill out this simple one-page form what the situation is going to be. Which I know that sounds like, oh, okay, but I know when the medical students come in, I'll point that out to them, and they'll be going like, oh, and I say, well, let's interview the patient and see. And I would say most of the time I'm correct. So, anyway, sometimes somebody will surprise me, but it's not too often. So yeah, that's kind of what I've done to, maybe smooth out my practice. So yeah.
And in contrast, if you had a magic wand and could fix one thing in your business or clinic tomorrow, what would that be?
Ooh, I have to say, I would want to put the magic wand on the pharmacist's head and say, listen, I know what I'm doing. Just fill the medication. I get so much problems with pharmacists. It just inundates my everyday, well, I'm just not comfortable with that. That's outside the FDA package insert. What are you trying? I've even had them say, what are you trying to do? Kill your patient? Or, well, that's an upper and a downer. So that has become a big struggle. So if I had a magic wand, that would be what I would want to use it on.
So it wouldn't be a magic wand. It would be a gag for the pharmacist by the sounds of it.
Yes.
And finally, so you've really built something special with your practice. What's on the vision? What's on your plan for the next 6 to 12 months, either professionally or personally?
Well, I am getting old, and my husband wants to retire. So we've kind of pared down our office hours a little, but I really enjoy what I'm doing. I would like to be more involved in the academic arena. I had looked at maybe there was a child psychiatric fellowship that had begun last year at Florida State University. And so I had talked with the dean of that program about maybe doing some of that, but it's difficult for us to kind of move out of what we have, because we have our private practice, we have patients, we have been here where we are living in our house for 30 some years. And so that was a little difficult, but again, with this internet technology and Zooms and all this stuff, it was said, well, maybe you could be a supervisor of some of the fellows by just communicating, maybe once a week in a treatment team fashion, using Zoom or whatever forum there like that. So I would be interested in doing that. I have a really good friend of mine who was one of the top people at Mutual of Omaha, retired, and he's into business administration and stuff. And he keeps telling me, you know, I ought to do a podcast. I'm like, I really don't. That just seems like a lot of intense time. I don't know how you do it really, but anyway, and I have several books I've sort of begun writing, like one I called Pass with Care, which is about life experiences and how we move through those. And then another one I started, which is called Face to Face, because people say, oh, you ought to write down about your patients and all your interesting anecdotes about patient lives and stuff. So I did start doing that, and I think it would be interesting, but I have to look at who my audience would be, and you know, be careful as far as not revealing anybody's information, because I know I could get past that, but just like, what am I really trying to accomplish by writing that? You know, I mean, there's so many books and things out now, and I don't know. That's another thing though that I've been thinking to do, is maybe write. As you can tell, I'm kind of a nerd. I love hiking and I love nature, and but to me, you know, living out there and doing that, like I have a friend who has an RV and they go out west for like 4 months at a time, right? And I'm going like, oh, as long as I have the internet and some area of research and I can get involved still, I would be okay with that. But I'm not really one to get away like that. So I haven't really decided what I'm going to do.
Sounds like the world's going to be your oyster. Sharon, thank you so much for your time this afternoon. It's been really interesting hearing about you and your practice, what you've done at Winters Family Psychiatry, and your insights into burnout and maintaining balance. So thank you so much for the conversation. I'm sure other people are going to resonate with what you say. Obviously, we'll put your details on the bio page so anybody can look you up and get in touch if they would like to from the contact details on the bio page. But thank you so much, Sharon.
Okay, well, thank you again for inviting me. I've enjoyed it. It was an experience to work through.
Good. Hopefully a good one.
Okay. Yes, it was.
Thank you.